Welcome to Pragnaviridhi, a lecture series for second year BAMS students. Let me Let me give a brief introduction of Panchajanya. Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of the Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality, but also as a way of life. All these while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. With this aim in mind, I would like to welcome you all to Pragnaviridhi lecture series conducted for second year students. Today we have with us Vaidya Ashok. Sir is currently working as an assistant professor in Samhita and Siddhanta Department, Taranath Government Ayurvedic Medical College, Bellary. He is currently doing PhD in Ayurveda Samhita Department under Dr. V. A. Chate, Professor GAMC Mysore. Sir has secured fourth place in KPSC 2022 Ayurveda Assistant Professor exam. Sir has secured ninth rank in postgraduate entrance exam of RGUHS 2012 Bangalore. Sir has the experience of teaching undergraduate students for 9 years. Good morning, sir.
Morning.
We are very grateful to have you here, sir. I will now hand over the session to you.
Thank you. Thank you so much. Without much delay, we'll start the session. Kiyanta Shirshia Adhyaya, myself Dr. Ashok Guther, Assistant Professor, Taranatha, Government Ayurveda Medical College, Bellary. In this chapter, this is the first chapter of Rogatushka as we studied tetrad of classification of diseases, dealing with description of diseases of vital organs, the head and the heart. Diseases are caused by disequilibrium of dosha in the body. The signs and symptoms of various permutation and combination of doshas imbalance are enlisted in this chapter. It also enlists and describes signs of depletion of dhatu and mala. The disorders of ojas are narrated, which continues with the depletion of madhumeha, that is diabetes mellitus, and carbuncles produced as its complication, that is prameha pidakas. Various types of doshagati are mentioned in this chapter. The comprehensive information about principles of basic Ayurvedic pathology is included in this chapter. So, before starting this chapter, actually, Charaka Samhita Sutra Sthana it contains fundamental principles of Ayurveda. Ayurveda is written based on the three sutra, that is Hetu Sutra, Linga Sutra, and Ausha Sutra. As we discuss this Rogatushka will be based on Hetu Sutra and Linga Sutra. Further, Ausha Sutra is described in the whole Chikitsa Sthana as a whole. Okay. It is the first chapter of Rogatushka, that is Kiyanta Shirshya Adhyaya. In this chapter, it is based on question and answer pattern. The questions asked by Agnivesha are Kiyanta Shirishi Purva Uktaha Rogaha Rudhi cha Dehinam Kati cha api Aniladinam Rogaha Manirkalpajaha Shaya Katihi Samakyata Pidaka Katihi cha Anagaha Gatihi Kativida cha Uktaha Doshanam Doshpudanaha. Am I audible?
Yes, sir. Please continue.
Okay, sure. The first question is how many diseases are related to the head and heart of human beings? The second question is how many are the disorders caused by various combination of discordant vata and other doshas? How many kshaya are there? how many papuls or pedika are there? Then last question is how many types of doshagati are there? These are the four questions asked by Agnivesha. The whole chapter is describing these questions. The first question is how many diseases are of head and heart? Okay, first question. The answer is दृष्टाः पञ्चशिरोरोगाः पञ्च एव हृदयामयाः व्याधीनां हि अधिकाः षष्टिः लिसन् व्याधीनाम् अधिकाः षष्टिः दोषमान विकल्पजाः फर्स्ट क्वेश्चन इज हाउ मेनी शिरोरोगा एंड हृदयामय दैट इज 5 each 5 shiroga and 5 rudroga are there. The next question is how many fermentation of combination of vata adhika dosha vadis? Those are 62. 60 plus adhika. Okay, 62 disorders are there in a fermentation and combination of doshas. The next dasha ashtaucha kshayaha sapta pidakaha मधुमेहिनः दोषाणां त्रिविध च उक्ताः दोषगतिः विस्तरतः शृणु. There are 18 types of kshaya mentioned in this chapter. There are 7 varieties of madhumeha pidika are explained. Then last one is there are 3 gatis or courses of doshas. Okay. First one that is shiroroga. It is of 5 types. Okay. The next shiroroga after shiroroga will discussing hridaya roga. That is also 5 times. His screen is visible?
No, sir. I'm sorry. Just a minute.
Okay.
Please present the screen again, sir.
It came again, welcome offer, PMAD, live stream recording, on webinar like that. Continue. Again, we'll be asking same questions since. Again, he is asking for free trial or try for just 100 rupees. Continue. Again, he is asking for card number. Shall I give the card number?
No, sir. No, sir. You just have to go back and go inside again.
Okay. It's 3 options are there: create, live stream, recording, and on-air webinar. Which one choose? Recording or a live stream?
Live stream, sir.
Live stream. Okay. Then studio, pre-recorded video, studio, right? Skip or no?
Yes, sir.
Title. Skip. After skipping, he is asking for title.
Sir, re-enter the link that I sent, sir.
Okay.
Just click the option present in that, sir.
Okay. Okay. The previous link is right.
Yes, sir. Yes, sir.
Okay. I have to present again, right?
Yeah, sir. Now just present, sir. It will be fine. I'm sorry for the inconvenience.
No, no issues. No issues.
Yeah, sir. Now just present, sir. I'm sorry for the inconvenience.
The screen is visible, not at right.
No, sir. Just give lesson screen in your account, sir.
Which one?
In your Dr. Ashok Gupta in that account.
Yes, now it's visible.
It is visible, sir.
Okay. There are 18 types of Kshaya and 7 types of Pramaya Pedaka and 3 courses of Gati of Doshas.
Sir, please unmute yourself.
Am I audible now?
Yes, sir. Yes, sir.
Okay. Course of diseases of head. Sandharnat, Divasapnat, Ratro Jagarnat, Madat, Uchaihi Bashyat, Avashayat, Purvatat, Atimaitunat, Gandhat, Asatmyat, धूम रजो हिम आतपात गुरु अम्ल हरित अदानात् अति शीतांबु सेवनात् शिरो अभिघातात् दुष्ट आमात् रोधनात् बाष्प निग्रहात् मेद आगमात् मनः तापात् देश काल विपर्यात् वातादयः प्रकुर्वन्ति शिरः तस्य सुरं च दुष्यन्ति तथा शिरसि जायन्ते रोगाः विविधलक्षणाः suppression of natural urges day sleep insomnia intoxication talking too loudly exposure to frost exposure to wind from the front or east excessive sex these are the karanas for the shiroroga especially vata shiroroga. Importance of the head. Puranam Puranabhutaha Yat Shirasa Tattva Indriyani Tad Uttamanga Anganam Shiraha Tadabyate. Shira is the foremost among all the organs as it is the reason of the body where the vital centers and all the senses of a living being are located in a vital among the all other organs. Is it echoing?
Yes, sir. It is. You can
What is
reduce
that?
the volume in other accounts. In other account.
Now?
Yes, sir. It is not echoing now.
Okay. Disease of head. अर्धवेदक वा स्यात् सर्वोमा रुजिते शिरः प्रतिशाय मुख नास अक्षि कर्णरोगाः शिरोभस्मः अरितं शिरसः कम्पः गल मन्य हनुग्रहः विविधाः च अपरे रोगाः वात आदि संभवाः. The Ardhavabedaka headache that is maybe involved in whole head, Kuryaja that is Pratishaya, disorders of mouth, nose, eyes and ears, giddiness, vertigo, facial paralysis, tremor of the head, stiffness of the neck, nape, jaw, etc. are the considered Shiroroga. Now also echoing seems. वातशिरोगाः उच्चैः भाष्याः अतिभाष्यायां तीक्ष्णपानात् पुरजागरात् शीतमारुतसंस्पर्शात् व्यवाय वेगनिग्रहात् उपवासात् अभिघातात् विरेकात् ओमनादिः बाष्पशोक. Is it echoing?
Yes, sir, it is echoing.
The problem is resolved yet. Already the other this one also will mute. Now,
Please talk, sir.
okay, no issues. We continue.
Yes, sir. Now it's fine, sir. Now it's fine.
Indulgence in loudspeak, excessive talk, strong drinks, awaking till the late night, exposure to cold wind, exposure, excessive sexual art, suppression of natural urges, fasting, trauma, excessive strong umana and virechana, excessive weeping, grief, fear, terror, excessive load carrying, weight bearing, wayfaring. Severe emaciation leads to propagation of vata, which by affecting the vessels of the head gets further provoked and produces severe pain in the head. This is the vataja shiroroga hetu. Then symptoms. Nesudate brusham shankau ghata sampiddate tataha sam भ्रूमध्यः ललाटं तपतीव अतिवेदनं वद्यते स्वपनः स्वनतः निष्कुष्यते इवाक्षणः गुणतीव शिरः सर्वं सन्दिभ्य इव मुच्यते स्फुरति अति शिराजालं स्तभ्यते च शिरोधरः स्निग्ध उष्ण उपशेते च शिरोरोगाः अनिलात्मकः. Intense pain in the both the temples, splitting sensation of the neck, excessive heat and pain in the forehead and between the eyebrows region, severe cutting pain and disappointment of ear, feeling as if the eyes are being grounded out, dizziness, sense of separateness in all the joints, excessive throbs in the blood vasculature, stiffness of the neck are the symptoms of Vataja Shoga. The Snigdha and Ushna are the things which will subside the Vata Shiroroga, as it is Snigdha and the Ushna are the opposite qualities of the Vata. The next Pitta Shiroroga, Katu, Amla, Lavana, Kshara, Madhya. रोजगाता अनिलैः पित्तं शिरसि संतुष्ट्या शिरोरोगाय कल्पते. Excessive use of pungent, sour, salty and alkali substances and wine, exposure to sun and anger leads to propagation of pitta, which by lodging in the head produces pitta predominant dominance of the head diseases. The pungent, sour, salty and alkali are the qualities of pitta, hence they will vitiate the pitta dosha and causes shiroroga. Symptoms of Shiroroga. Dahyate rujyate tena shiraha शीतं संशूयते दह्यते चक्षुषी तृष्णाः भ्रमः स्वेतश्च जायते. Burning sensation and pain in the head, desire for cold things, burning sensation in the eyes, thirst, giddiness and perspiration are the symptoms of pitta predominant disease of head. The next kapha shiroroga hetuः आस्यासुकैः स्वप्नसुखैः गुरु स्निग्ध अतिभोजनैः श्लेष्मा शिरसि संदुष्ट्य शिरोरोगाय कल्पते. These are the common nidanas of kaphacha roga as well. Asya sukha, that is sedentary lifestyle, swapna sukha, excessive sleep, guru, that is heavy food, snigdha, that is oily or unctuous meals, atibhojana, excessive food intake. These are the common kapha kara nidanas. They increase or vitiate the kapha dosha in the head and then causes the Kaphaja Shiroroga. The symptoms are Mandarujaha tena suptam stimita bharikam bhavati utpadite tandra tata alasyam arochikam. Dull headache, numbness in the head region, stiffness and heaviness in the head region, drowsiness, laziness, and androdhya are the symptoms of kapha dominant shiroroga. Tridosha Shiroga contains all the Tridosha Lakshanas and Nidanas of all the Tridoshas. This is the fourth variety. Vataja, Pittaja, Kaphaja, Tridoshaja, that is Sannipataja. And last one is Krimija Shirologa. The etiological factors are Karana and pathogenesis of Krimija Shiroga. Tila, Shira, Guda, Jirna, Poti, Sankirna, Bhojanata, क्लेद असृक् कफ मांसानां दोषिलस्य उपजायते तथा शिरसि संक्लेदात् संक्लेद is the main word here कृमयः पापकर्मणः जनयन्ति शिरोरोगं जातः बिभत्स लक्षणम्. When a person is provoked with dosha, indulges in excessive intake of season, that is tila, that is kshira is milk, and molasses, takes meals even when previous meal is not properly digested, eats putrefied or premenstrual food, and it takes incompatible diet, it causes biochemical discharges of rakta, kapha, and mamsa, wherein parasites are produced, leading to this Krimija Shiroga, which is dreadful in nature, arises. The main reason is Tila, Kshira, and Guda. These are the main reason. If you kept outside also, this mixture causes production of krimis. Then symptoms of Shiroroga, Veda, Cheda, Ruja, Kandu, Shofa, Daurgandhya, Dukkitham, Krimi Rogaturam, Vidyat, Kriminam, Darshaninacha. The patient of Krimi Shiroroga suffers from piercing, cutting, or aching pains in the head region with itching, swelling, and foul swimming, and detectable parasites also. That is, Krimi also visible. Then after finishing this Hirudroga, we'll enter into the that is Hirudroga. It is also five types, that is Vataja, Pittaja, Shleshmaja, Tadoshaja, and Krimija. This is the similarities between Shiroga and Rudroga. Both are having variety of Krimija as the fifth variety. The Vataja Nidanasa, Shoka, Upavasa, Vyayama, Ruksha, Shushka, Alpa Bhojanaihi, Vayuhu Avishya Rudayam, Janayanti Uttamam Rujam. The Shoka, Upvasa, Vyayama, Ruksha, and Shushka Alpa Bhojana are the Nidana for the vitiation of Vayu. If it indulges or enters into the heart, causes severe pain. That is called Vataja Rudroga. Then we will see the symptoms of Vataja Rudroga. Vyapatu, Veshtanam, Stambaha, Pramoha, Shunyam, Darha, Rudhi, Vatature, Rupam, Jirnam, Cha, Atyartha Vedana. The symptoms of Vata predominant disease, heart disease are fibrillation, cardiac cramps, pauses in the cardiac beats, stupor, sensation of emptiness in the cardiac region, and murmurs. That is Dhara. These are the symptoms of Vataja Rudroga. Then after the Vataja Rudroga, then we will enter the Pittaja Rudroga. Ka Ajirna Bhojanaihi, Madhya Krura Rodat, Madhya Rodat, आतपैः च आशुः हृदिः पित्तं प्रकुप्यति. Excessive intake of hard, sour, pungent, salty, and alkaline food articles, alcohol, exposure to sun, and anger are the common causative factors of pitta vitiation and causation of pitta roga, pittaja rudroga. The symptoms of pitta roga are rudraha, tiktata, vaktre, tikta, amla, udgiranam, klamaha, trishna, murcha, brahma, svedaha, pitta, rudroga, lakshanam. Burning sensation in the precordial region, bitter taste in the mouth, sour erections, exhaustion, thirst, fainting, giddiness, and perspiration. These are the common symptoms of pittaja heart disease. We see all these lakshanas in a MI also. Snigdha, Snigdham, Achintanam, Acheshtanam. Achintanam and Acheshtanam are the main nidanas. Nidra Sukham Cha Abhyadikam Kapha Rudroga Lakshanam. The similar nidanas are seen in the Kaphaja Shiroroga also. Asya Sukha, Sapna Sukha, etc. Here, Atyadanam, overthinking, intake of heavy and fatty substances, worry-free and sedentary lifestyle, excessive sleep are the common causative factors of Kafja Rudroga. After Nidanas, we see the symptoms. Hridayam, Kapha, Rudroge, Suptam, Stimita, Bharikam. It is the very important term, Bharikam. Tandra, Aruchi, Paritasya, Bhavati, Ashmavrutam. Ashmavrutam also very important term. Numbness, stiffness, and heaviness in the pericardial area. Stony sensation. As we kept a stone in the heart, that will be considered as Ashmavrutam or Bharikam in the heart region. Drowsiness, anorexia are the kapha predominant heart disease Lakshanas. Then Tridoshija Rudroga, as we see in Tridoshija Shiroroga, the same, all the Dosh Nidanas and all the symptoms are seen in the this particular Nidana related to the Tridoshas. It is considered as Rudroga, Kashtadaha, Kashtasadhya Ukta, Marshibi. It is difficult to cure or troublesome diseases. The last variety of Rudroga, that is Krimja Rudroga. Tridoshjetu Rudroge Yo Duratma Nishevate Tila Kshira Gudadini. Again, same thing. Tila Kshira Gudadini Granti Tasya Upajayate Marma Ekadeshe San Kleda. Again, Kleda is also very important. That we see in the Shira Ruga also. Kleda means moisture. Rasascha Upagachanti San Kledat Krimeyaha Cha Asya Bhavanti Upahatatmanaha Marma Ekadeshe te jataha sarpantaha bhakshanti cha. It is a very important term, bhakshanti. It causes, consumes the muscles of heart. As unfortunate person, that is Duratma, already suffering from Tridosha Rudroga, if further indulge in excessive intake of sesame, that is Tila, Kshira, and Guda, then it develops swelling in the channels of heart, leading to the softening of the affected area, making it vulnerable for worm infestation. This infestation can spread and consume heart tissues. Bhakshanti Tadaha. It is the main term. The both the Shiroroga and Rudroga of premature, the Nidana is similar. The patients suffering from Tidosha Rudroga are Shirorogas. Indulgence in Tila, Kshira, and Buddha in excessive quantity causes krimi in the head Shiroroga, heart in the Rudroga. Krumija Rudroga symptoms. Tudyamanan sa hridayam सूचिभिरेव मन्यन्ते छिद्यमानं यतः शस्त्रैः जातकण्डुः तु एतैहितं. The patient of premature Hridroga feels severe pain in the pericardial region, complaints of itching as if heart is being pricked and pierced with the needles and cut open by weapons. These are severe type of pain will be there in the heart region. The premature is very grave heart condition, may lead to immediate death also. Therefore, it should be promptly diagnosed and attended immediately. General principles of symptoms increase and decrease dosha. This is the next concept. Doshaha praruddaha swalingam darshayanti yatha balam kshinaha jayati lingam swam samaha swakarmam kurvate. An increase in the dosha causes consequent provocation to the same extent as the increase as of a symptom of a disease. On the other hand, decrease of dosha leads to decreased or reduced function. This is very important. Usually, dosha buddhi is considered as severe compared to the desha kshaya, because dosha kshaya is very less that it will erupt the symptoms, whereas dosha buddhi up to its extent it will produce the symptoms and helps in the diagnosing disease. Last word is swam karmam kuro, that is the equilibrium doshas does the functions of normal doshas. As we seen, the mana vikalpa of dosha, tridosha is 62 types. That is not explained here because of that is very vast and confusing. Then directly we entered the concept called shaya of dosha, dhatu, etc. That is 18 types of shaya. Among them, decrease of dosh ras dhatu, gatyate sahate shabdam na uchchaihi darshya न उच्चैः दुर्वति शूल्यते हृदयं ताम्यति स्वल्पचेष्टा से अपि रसक्षय. The symptoms of diminution of ardhatu include restlessness, that is gatyate sahate shabdam न उच्चैः दोष्यते, intolerance of loud sounds, acceleration of flow, that is tachycardia, pain and distress even with the slightest exertion. These are the common rasdhatu shaya lakshana. We seen in the Ashtanga Hridaya also same thing will be there. Then decrease of rasdhatu parushaha sputitaha mlanaha tvakrukshaha rasankshay. It is very clear. The decrease of rasdhatu includes roughness, cracks and withering and dryness of the skin. Decrease of mamsdhatu mamsakshaye visheshena spik griva udara shushkata. We have seen spik udara and sthana vruddhi will be there in the medu dhatu, whereas mam dhatu kshaya causes these kshaya of the or decrease of the hips, neck and belly region because it is the previous dhatu of medu dhatu. Is it clear? Shall I continue?
Yes, sir.
Okay. Decrease of medatu sandhinam sputanam glani akshno ayasa evacha lakshanam medasi shirine tanutvam chaudharasya cha. Symptoms of decrease of medatu include cracking of the joints, lassitude of the eyes, exhaustion and thinning of the abdomen. Thinning of the abdomen is the seen in the same medatu decrease lakshana. अस्यातु क्षय लक्षण केश लोम नख श्मश्रु द्विज पर्पतनम श्रमः ज्ञेय अस्तिक्षये लिंगः संधि शैथिल्यम एव च. Symptoms of decrease of अस्यातु are the loss of scalp and body hair, beard, nails and teeth, fatigue and loose joints. मजातु शिर्यन्त इव च अस्तिनि दुर्बलानि लघुनि च प्रततम वातरोगिणः क्षीणे मज्जनि देहिनम. Symptoms of decrease of madhyatu are atrophy of the bone tissue, weakness and lameness of the bones, and the patient suffers frequently from vata because majja is filled in the asti dhatu. The less majja it includes more vata, that is ashraya lakshana of asti and vata dosha. Decrease of sukratu daurbalyam mukashosha pandustam sadanam shramaha klaibyam shukra avisargascha kshina sukrasya lakshanam. Symptoms of decrease of shukra includes debility, dryness of the mouth, pallor, asthenia, fatigue, impotency and absence of ejaculation, that is shukra avisarga. Absence of ejaculation is seen in the kshina shukra lakshana. Then क्षीण पुरुष क्षीणे शकृति च अंतराणि पीडयन्नीव मारुतः रुक्षस्य अन्यन् कुक्षिं तिर्यग् ऊर्ध्वं च गच्छति. In decrease of the purusha, provoked vata causes painful peristalsis in the intestine which spreads upwards and oblique, causing distension of belly and dryness. These are the symptoms of purusha kshaya. Then decrease of mutra. मूत्रक्षये मूत्रकृच्छ्रं मूत्रवैवर्ण्यम् एव च पिपासा बाते च अस्य मुखं च परिशिष्यति. Symptoms of decrease of mutra include dysuria, discoloration of urine, excessive thirst and dryness of the mouth. Dryness of mouth is in the so many diseases. In the previous shukra also it is in that dryness of the mouth, that is mukashosha. Malayana, decrease of Malayana. Malayanani cha anyani shunyani cha laguni cha vishushkani cha lakshante etaswam malakshamshayi. There are 5 other minor malas which are malas of nose, ears, eyes, mouth, skin, etc. These deficiency leads to feeling of emptiness in the ashaya, lightness of the ashaya, and dryness of the respective receptacle of that mala. Then one very important topic, that is ojas, that is ojakshaya is explained here. Pipeti durbalo abhishnam dhyayati vityendriyaha dushchayo durmanaha rukshaha kshamascha eva ojasa kshaya. The symptoms of decrease of ojas include timidity, debility, constant worry, discomfort of the senses, loss of luster, neurasthenia, dryness, and emaciation. We already seen this sloka in the first year also. Bibeti durbala bhikshnam dhyayati uttendriyaha dushchayo durmanaha rukshaha kshamaschaya. Sham is dryness. Then after the shaya, we are entering the concept called ojas. हृदि तिष्ठति यत् शुद्धं रक्तम् ईषत् पीतकम् ओजः शरीरे संख्यातं तत् नाशात् न विनश्यति. Na vinashti means not negative. Na means here a person or human being. The ojo nasha will be leads to the nasha of the person. The ojas is clear and slightly red yellowish substance situated in the heart. Okay, its destruction leads to death. प्रथमं जायते ओजः शरीरे अस्मिन् शरीरिणां सर्पिवर्णं मधुरसं लाजागन्ति प्रजायते. The ojas is very first substances created in the body in all the living. So its color resembles that of ghee, tastes like honey, and smells like roasted paddy. Okay, how the collection of this ojas takes place? The example is given. Beautiful example is given. Brahmaraihi palapushpebhyaha yata sambriyate madhuhu tat tadvat, like that ojah swakarmebhyaha gunaihi sambriyate nranam. As honey is collected from the bees, from the various fruits and flowers, similarly ojas is collected by the inherent vital qualities of man from the various physiological process that takes place in the body. That's why it is called as Ashtama Dhatu. These are the general ecological factors of Ojakshaya. Then the next concept is Madhumeha. It is related to the Madhu Ojas. That's why it is explained after the description of Ojas. The common ecological factors and patterns of Avrta Madhumeha. This is very important. Guru Snigdha Amla Lavanani Ati Atim Aturam Samashnam Navam Annam Cha Panam Cha Nidra Ama Asya Sukani Cha Tyakta Vyayama, that is in not indulging in a Vyayama, Achintana, not indulging in the worries, Samshodhanam, Akuratam, without any Samshodhana, not taking the proper Samshodhana. By these all Idhanas, Sleshma and Pitta, Meda, Mamsa are disturbed or vitiated. Those things causes taihi avrutaha gatihi vayu. This leads to obstruction to the movement of vayu. This in turn causes ojaha adaya gachati yada bastin. This obstructed vayu does the function of, does the activity of bringing the ojas to the basti, then causes the avruta madhumeha. It is kruchra. Okay. Symptoms of Avrta Madhumeha. Sa Marutasya Pittasya Kapasya cha Muhu Darshayati Akrutim Gatva Chayam Apyayati. In this condition of Madhumeha, the symptoms of Vata, Pitta, and Kapha are frequently manifested. These symptoms subside for some time and again reappear later. This is the Avrta, that's why this thing will be seen. Sometimes it appears and sometimes it subsides. The next is Sapta Pidaka. How many Pidakas are there? The question asked by the Agnivesha. Those are 7 Pidakas are there. These are the complications of Prameha. If Prameha is not treated properly, not handled properly, these Pidakas will be arising. उपेक्षया अस्य जायन्ते पीडकाः सप्तः दारुणः. These are the daruna in nature. मांसलेषु अवकाशेषु, the space that in the मांसा, मर्मसु अपि च संदेषु, in the all regions, the शराविक, कच्छपिक, जालिनी, सर्षपी तथा अलजी, विनताक्य च विद्रदी च सप्तमी. These are the 7 types of पीडका arises due to the improper management of diabetes mellitus. First one is Sharavika, second one is Kachapika, third one is Jalini, fourth one is Sarshapi, fifth one is Alaji, sixth one is Vinata, last one is Vidridi. The names of these Pidakas are named according to their structure or their nature of the wound. First one is Sharavika. Sharavika is in pot. The description is Anta Unnata, edges are elevated, Madhyaha Nimnaha, the middle part is concave in nature. Shavaha Kleda Ruganvitaha, Sharavika Syat Pidakaha, Sharava Akruti Samsitaha. This is looks like Sharava Akruti. That's why it is called as Sharavika. The edges of this Sharavika Pidaka are raised and middle part is depressed and its color is dusky red. It looks like
Sir, you aren't audible right now. Sir, you aren't audible.
now is it audible?
Yes, sir. Now it is audible.
Okay, due to some call, it is disturbed seems.
It's okay, sir. Please continue.
Okay. Jalini स्तब्धाः स्थिरजालावतिः स्निग्धासुराः महाशयाः रुजा निस्तोद बहुलाः सूक्ष्मच्छदाः जालिनीः. Jalini Pidika is extensive, hard, covered with a network of vessels. That's why it's called the Jalini, with unctuous discharge, that is Snigdha discharge, having severe pricking type of pain and having minute openings of the surface. It is called Jalini. Spider web. The next one is Sarshapi. As we discussed, fourth variety is Sarshapi. Pidakaha na ati mahati Kshipra Pakaha Maharojaha Sarshapi Sarshapahi Pidakaha Abhischitaha Bhavet. Sarshapa are the Sarshapi looks like mustard, that's why it is named as Sarshapa. Sarshapi Pidaka is not very big, but it is very painful and separates quickly, and it is surrounded by mustard like boils. Fifth one is allergy. Dahati Twacham Uttane Trishna Moha Jwara Pradaha Visarpa Ati Visarpati Anisham Dukhat Dahati Agniriva Allergy. Allergy Pidika commences with a burning sensation of skin accompanied by fever and thirst. It steadily spreads all over the body and causes severe distress with the fire-like burning sensation. Allergy and Visarpa looks like same. Vinata Avagadah, Ruja, Kledah, Prushteva api Udare, Prushta and Udara at the sides of Vinata, Va, Mahati Vinataha, Neela Pidakaha, Vinata Mataha. Vinata Pidaka are extremely painful form of pustule. It is soft and situated either in the back or abdomen, very extensive and depressed in the middle and bluish in color. It is known as Vinata. Okay, it is depressed in the or deep. Last one is Vidradi. It is of two types, Bahya Vidradi and Antarika Vidradi. We already known. Vidradi Dvividam Ahuhu Bahya Abhyantrin Tataha Bahyaha Stvak Snayu Mamsottaha Kandarabaha Maharojaha. Vidradi of two types, external and internal. External abscess can occur in the skin and flesh. It looks like tender and can cause severe pain. The heterological pathology of internal abscess, excessive use of cold, stale, irritant, hot, unctuous, and dry food articles, diet and incompatible, wholesome, unwholesome articles, indigestion, spoiled foods, irregular eating, imbibing, spoiled and excessive wines, suppression of natural urges, fatigue, exercise in distorted postures, excessive sleep, carrying heavy loads, excessive wayfaring, and excessive sex activity are the etiological factors of the internal abscess. The next concept is Vidradi. Drushtaratra atimatratvat sa vaihi shigram vidahyate. Shigram vidayate quickly, softening. Fatah shigra vidayitvat vidradihi iti abhidiyate. This is the definition of Vidradi. Excessive provoked rakta causes quick softening and formation of pus in the region. Owing to this quickly separating its characteristic, it is called as Vidradi. Types Vata Javagdhi, Pitta Javagdhi, and Kapha Javagdhi. Lakshanas are similar to the doshas. Symptoms of ripening abscess शस्त्र अस्त्रैः विद्यतः इव च उन्मूलकैः इव दह्यते विद्रदिः व्यम्लता याताः रुश्चिकैः इव दश्यते. The ripening of abscess, the patient feels as if it is cut by a weapon or as if burned by a coal or as if stung by a scorpion. This Rushchika Jamshavat pain we see in the Amavata also. First discharge according to type of abscess. In Vataja type of abscess, the discharge is thin, ununctuous, dusky red and soti, tanu, ruksham, arnam, shavam, phenylam, vata vidradihi. Tila, masha, kulatta, sannibam, pitta vidradihi. It looks like tila, masha and kulatta. Yusha. Saishmiki, sravati, shvetam, pichilam, bahalam, bahu. These are the lakshanas of Laishmika. Lakshanam sarvam etaihi tat bhajate sannipatiki. All lakshanas are seen in the sannipatika variety of abscess, that is Vidradi. Route of discharge, separated internal abscess burst and the pus is discharged. The discharge of abscess situated in the organs above the navel comes out from the mouth and situated below the umbilicus comes out from the anus and around the navel may come out from the any other routes, that is Urdhvagata, Tiryagati and Adhogati. Urdhvagati from the mouth, Adhogati that is from the anus and Tiryag means any other routes. Then next, the abscess occurring in the heart, umbilicus and urinary bladder as well as Sannipatika type, if separated, have bad prognosis, that is Kashtasadhya, may lead to death. The remaining type of abscess, if treated immediately by an expert physician, are curable. Therefore, immediately on appearance of internal abscess, it should be managed promptly with effective measures that can act quickly, else it may harm just like an injury caused by weapon. Shastraihi Dushta, separately, but bite by a snake and burning by a lightning or quick or fire. These abscesses may be managed by oleation, that is Snehana, and purgation therapy, that is Virechana, as well as measures of Gulma. then साध्यहत्या पीडिका वितौट् प्रमेयः भवन्ति च आतुरः विना प्रमेहम् अपि एताः जायन्ते दुष्टमेधसाः तावत् च एता न लक्ष्यन्ते यावद् वास्तु परिग्रहः. Pustules that can occur visualization of Miratu in a person who is suffering, not suffering from prameha. Such pustules do not become visible till they become extensive in size. पीडिका विथ प्रमेह शराविका कच्छपिका जालिनी चेति दुस्साहः जायन्ते हि अतिबलाः प्रभूत श्लेष्म मेधसाः. शराविका कच्छपिका जालिनी, these are the types which are formed by excessive kapha and medhatu. Therefore it is difficult to cure. It is severe and can cause unbearable pain. सर्षपि जालिनी च एव विनताः विद्रदि च याः साध्याः पित्त उल्बणाः तु Sambhavati Alpamesa. Sarshapi, allergy, Vinata, and Vidradi occur due to dominance of Pitta in a person having less quantity of Mirato and are curable. This is the Khadya Khatya of Prameha Pidakas. Complications of Prameha Pidaka. Throat, Shwasa, Mamsa, Sankota, Moha, Hikka, Mada, Juraha, Visarpa, Marma, Sambrodha, Pidakanam, Udbavaha. Thirst, dyspnea, sloughing of the face, stupor, hiccup, toxemia, fever, spreading of inflammatory swelling, and obstruction in the function of vital organs are the complications of Pidakas. The last concept, that is Doshagati. Doshagati is of three types we already discussed. Those are many types in they are divided into many types. First one is Kshaya, Sthana, and Ruddhi. That is equilibrium of doshas, increase and decrease of doshas. These are the three types of dosha gatis. Then other type is Urdhvagati, Chadagati, and Tiryagati are the three other types. Then other type of again one more type is the Koshta, Shaka, and Marmasam. So that is Bahyagati and Abhyantaragati and Madhyam Gati of dosha. These are the three types of three dosha gatis. Then one more type is Gatischa Vivida Dushtaha Prakruti cha Vaikruti. Gati is of two types. One is Prakruta and one is Vaikruta. पित्तात् एव उष्मणाः पक्तिः नराणाम् उपजायते तच्च पित्ताः प्रकोपितं विकारान् कुरुते बहुन् प्राकृतस्तु बलं श्लेष्माः वैकृतो मलः उच्यते स च एव ओजः स्मृतः काय च पाप्मा उपदिश्यते सर्वा हि चेष्टाः वातेन स प्राणिनां स्मृतः तेन एव रोगाः जायन्ते तेन च एव उपरुदते. Here two gatis, that is prakruta and vaikruta, are explained. Another set of dosha which are physiological and pathological. Normally heat is generated by pitta, that is ushma, which is helpful in the digestion of the food. Okay. Then next, kapha is responsible for body strength as it is becomes waste material. So normal kapha is responsible for production of oja also. However, in a provocation or in a vijayation, it causes ailments. Last, vata is responsible for all types of movement in the living beings and represents life of a living beings. But vitiated vata causes many diseases and even if it is responsible for death also. By this, we finish this Kiyanta Shirshi Adhyaya. Only one topic which is left, that is Dosha Mana Vikalpaja 62 types. Those are based on Taratama Bhava of doshas. One is normal, another one is increase, and another one is severely increased. Like this, those are 62 types of Mana Vikalpas. These 62 types can cause any diseases. Okay, based on that, diseases are formed. Shall we start another chapter, that is Trishoti Adhyaya?
Yes, sir.
Okay.
The screen is visible, sir.
Okay, thank you. The next chapter is Trishoti Adhyaya. The highlights of this chapter are the preceding chapter enlists swellings, that is, in the form of carbuncles, Pidaka. This chapter provides further details about causative factors of endogenous and exogenous, that is, Nija and Agantu Shota, signs of dosha dominant swellings, their locations in the body, and principles of treatment. Further, the guidelines to diagnose a new disease. This is very important for any new disease and criteria for clarification of this narrative. The specific normal functions of dosha are described in this chapter. These functions, if disturbed, are aptly inferred as clinical signs of early changes of the in the body. They are used diagnosis of a disease in the early stage and prediction of the future disease. The first shloka, त्रयः शोताः भवन्ति वातपित्तश्लेष्मनिमित्ताः ते पुनः द्विविध निज आगन्तुभेदना. The chapter started with त्रयः शोताः, that's why it is named as Trishotiya Adhyaya. It is one type of method used to name a chapter. There are three shotas are there, Vataja, Pittaja and Kaphaja. Further, they can be classified into two types, that is Nija and Agantu. I'll briefly discuss. Nija means endogenous, whereas Agantuji means exogenous, internal causes and external causes. The hetus for exogenous swelling. तत्र आगन्तवः छेदन भेदन क्षणन भञ्जन पिच्छन उत्पेषण प्रहार वध बन्धन वेष्टन वेदन पीडन आदिभिः वा बल्लातक पुष्प फल रस आत्मगुप्त शूक कृमि शूक हित पत्र पत्रलता गुल्म संस्पर्शनैः वा स्वेदन परिसर्पण तौ वा विषीणां सविष प्राणि दंष्ट्र दंत विषाण नक निपातैः वा असगरविष वात हिम दहन स्पर्शनैः वा शोताः समुपजायन्ते. Chedana means excision, Vedana means incision, Kshanana means churning of bones, Bhanjana means breaking, Pichana means excessive squeezing, Utprashana means grinding, Prahara means hitting, Veda means stroking, Bandhana binding, Veshtana twisting, Vedana piercing, Pidana pressing, etc. These are the external causes. Some other causes are contact with juice of flowers or fruits of the some plants like Ballataka and Atmagupta. We already know Ballataka causes blisters. Atmagupta also causes some allergies. Those are considered as external causes. Some other external causes are getting bitten or stung by certain insects or touching irritant leaves, climbers, shrubs, sweat or urine of the poisonous animal, even coming in physical contact with them, or getting injured by their teeth, horns, nails, or exposure to marine, that is salt water or poisonous air, exposure to excessive cold. These are the lakshanas for inflammation of skin or inflammation of the soft tissues also. Causes of lakshan, causes of inflammation. Then nija shota. Nijaha punaha sneha sweda vamana virechana astapana anuvasana shiro virechana नाम अथवा यथावत् प्रयोग प्रयोगात् मिथ्या संसर्जनात् छर्दि अल्लसक विसूचिक श्वास कास अत्सार शोष पांडु रोग उदर ज्वर प्रदर बगंधर हर्ष विकार अतिकर्षणैः वा कुष्ठ कंडु पीडकादिभिः वा छर्दि क्षवतु उद्गार शुक्र वात मूत्र पुरुष वेगधारणैः वा कर्म रोग उपवास अध्वकर्षितस्य वा सहसा अति गुरु अम्ल लवण पिष्ट अन्न फल शाक राग दधि हरित मध्य मंदक विरूढ़ नव शूक शमी धान्य अनुप ओदक पिशित उपयोगात मृत पंक लोष्ट भक्षणात् लवण अतिभक्षणात् गर्भ संपीडनात् आम गर्भ पतनात् प्रजातानां च मिथ्या उपचारात् उदीर्ण दोषत्वात् शोफाः प्रादुर्भवन्ति इत्युक्ताः सामान्यहेतवः the common hetological factors of doshaja shota improper administration of snehanadi panchakarma complication of other diseases like chardi adi due to suppression of natural urges weakness caused by therapeutic purification that is shodhana chronic diseases, long-standing vyadis, fasting and excessive walking, dietary factors, antenatal and postnatal factors. These are the common causes of Nija Shota. Then we'll see Vata Shota. This swelling increases as well as subsides quickly. This is the main Lakshana. Black or reddish in color, pleating, pulsating with coarse skin, rough or broken hair. The person feels different types of pain sensation like chidyati, vidyati, tuchi bireva, traveling of ants, irritation, and feeling of contraction or expansion. These are the lakshanas and causes of the Vatika Sota. Again, the shloka is explained in the next few slides. That's why I am not reading this one. Pitta Shota, it also increases and subsides quickly. The affected part becomes reddish, yellow, bluish, copper tinged, hot, or soft with brown or coppery hair. It gives burning sensation of various forms and could be hot, sweaty, and moist. The affected region could be tender to touch and very sensitive to heat. Then Shleshma Shota, that is Kapha Shota. The causes are kapha-induced swellings grow slowly and subsides with difficulty. Affected parts become pale, whitish, heavy, unctuous, smooth, stable, thick, and with the white hair, the tolerant of touch and heat. प्रकृतिभिः ताभिः विद्यमानाः द्विविध त्रिविध चतुर्विध सप्तविध अष्टविधश्च शोताः उपलभ्यते पुनः च एक एव उत्सेद सामान्यः. This is the various types of shota or any other diseases. Okay, if Shota is one type based on the common Lakshana or common signs, that is swelling, that is increase of the size. Okay, it can be classified as two types based on the Hetus, Nija and Agantu, three types based on the Doshas, Vataja, Pitaja, Kafaja, four types based on the Tridosha plus Sannipatika, seven types Tridosha, Ekadosha, Tridosha and Sannipatika. Like this, we can classify Shota or any other general diseases. This is the general classification of the disease based on the characteristics, which can be either one or two or three or seven or eight. Like this, we can classify. So Vatika, Paitika, and Shleshmika Shota. The previous shloka are in the Gadya form. This is in the Padya form or in the Pad form. Shunyate yassa गात्राणि स्वपन्ति इव रुजन्ति च पीडितानि उन्नमति आशुः. If you press a body part, if it quickly come back to normal position, that is Vatika Shota. Vata Shota Tamadished. Yaschapi Aruna Varnabha. It's in maroon color or red color. Shotaha Naktam Pranashyati. It will be subside in the night time, again erupts in the daytime. By application of Sneha Ushna Mardana, it will be decreased or subsided. The next one is Pitya Shota. यह पिपास ज्वर आर्तस्य दूह्यते अतः विदह्यते स्विद्यति क्लिद्यति गन्धि च प्रत्यः श्वेतु स्मृतः. It is associated with pipasa and jwara. Severe type of burning sensation will be there in this Pittaja Shota. That is the classical feature of Pittaja Shota. Svidati means there will be sweating. Klidati means there will be moisture. Pitta Gandha will be there. Then Yaha Pita Netra Twak Purum Madhyat Prashuyate Tanu Twak Cha Atisari. It has with Pita Netra and Rakta Netra and Twak also and Atisara. Then last one is Kafaja Shotel Kafaja Shota Shitaha Saptagatiriyak Tiryak Astuhu Kanduman Pandurevacha Nipiditaha na unnamati. If you press it, it will not come back to the normal state. That will be pitting edema. Shvetuhu sakafatmakaha Yasya Shastra Kusha Chinna Shonitam na pravartate. If you cut this Shleshmaja Shota, it will not bleed with the Shastra Kusha. That is the main lakshana of Kapha Shota. Krichrena Picha Sravati Chapi Kapha Sambhavaha. If you cut it, it will be, the thick fluid will be flown. Nidana Akruti Samsargat Shvetuhu Syat Didoshaha. If two doshas are involved in a shota, that is called as Didosha Shota. Didosha Shota. If all the three dosha are involved, that is called as Sannipatika Dosha. So, Sannipatika Shota. The next one is prognosis of Shota. Yastu Padabihi Nivruttaha Shotaha Sarvangagaha Bhavet. If the Shota is start from the Pada and spreads all over the body in a person, it is considered Kashtaha Syat Prasutaha Stri Mukacha. If it starts from the Mukha and spreads all over the body, in case of Stri and Prasuta, that also considered Kashtaha. Jaschapi Guhya Prabhavaha Striyava Purushasa. In case of both Stri and Purusha, if it is present in the Guhya Prabhavaha, that is in the genital regions, it is considered as Kashtatamaha. And if it is with the Upadrava, that's also Kashtatama, difficult to cure. This is very important shloka. Complications of Shota. Saptaka is the underlined word, that is, it is of 7 types or 7 main symptoms or diseases which are the complications of Shota are Chardi, Shwasa, Aruchi, Trushna, Jwara, Atisara, Dorbalya are the Upadravas of the Shota. That is vomiting, breathlessness, anorexia, excessive thirst, pyrexia, that is fever, diarrhea, and weakness. These are the 7 complications of Shota. Saptako, Dravya Sangraha, the word we seen in the Kushta. Here, Saptako, Upadrava seen in case of Shota. Next, we will see the Shota with respect to some regions. First one is Upajivika, that is ranula. Yasya shleshmaha prakupitaha jihva mule avatishtate ashu sanjane shotam jayate asya upajivika. When vegetated kapha dosha begins from the root of the tongue, or it is also the root of the tongue and causes the swelling, it is called the upajivika, that is ranula. It is shown in the figure. The second one is Galashundika, that is oolitis. Yasya shleshmaha prakupitaha kakale. Kakale means it is the oola. Yavatishtate ashu sanjane shofam karoti galashundika. The vegetated kapha inhabits in a oola, produces swelling suddenly, that is called galashundika. The next one, Galatin, that is Galaganda. Yasya shleshmaha prakuvitaha gala bahya avatishtante shanaihi sanjane shufam galagandaha asjayada. A swelling that is caused when a vegetated kapha affects the throat from the outside and gradually produces swelling, it is called Galaganda. The next variety is Galagaha. That is pharyngitis. Yasya shleshmaha prakurvitaha tishtanti antargalaha. Antargala means throat. Stiraha ashuhu sanjane shofam jayate asaglaha. When vitiated kapha firmly located inside the throat causes suddenly swelling, that is called galagraha. Inflammation of pharynx. The next one is Visarpa, that is erysipelas. Yasya pittam prakuritam saraktam tvachihi sarpati shoshofam saragam sanjanayet visarpasya jayate. When vitiated pitta with rakta, that is blood, spreads through the skin, it causes swelling with redness. Such a swelling is called as Visarpa. The next one is Pidika, that is boiler pustules. यस्य पित्तं प्रकुर्वितं त्वचिः सरक्ते अवतिष्ठन्ते शोतं सरागं जनयेत् पीडकः तस्य जायते. When the vitiated pitta located within the skin and rakta, swelling and redness appears, that is called as pidika. It is mentioned in the pictures as pimple and boil are the example for pidika. Then some other types are yasya prakurvitaha pittam shonitam प्राप्यम शुष्यति तिलकः पिप्लवः व्यङ्गः नीलिकां स जायते. When the vitiated pitta goes into rakta and gets absorbed in it within the blood, it causes tilakaha, piplu, and venga. The pictures are shown. Tilaka means mole with like a tila. Piplu means port wine marks. Venga means blemishes. Nilika means blue dark moles. यस्य पित्तं प्रकुर्वितं शङ्ककः अवतिष्ठते श्वयतुः शङ्ककं नामः दारुणकस्य जायते. When vitiated pitta inhibits the temper regions of head and severe fatal swellings are known as shankaka. The next one is कर्णमूल गतशोथ. यस्य पित्तं प्रकुर्वितं कर्णमूले अवतिष्ठते ज्वरान्ते दुर्जेह अन्ताय शोथः तस्य उपजायते. When the vitiated pitta located at the base of the ear, a severe incurable fatal swelling arises at the terminal stages of fever. Am I audible?
Yes, sir.
Okay. Vatah plihanam udduya कुपितः यष्टिष्ठति शनैः ऋतुदन् पार्श्वं प्लीहः तस्य अभिवर्तते. When the vitiated vata inhibits and elevates the spleen, it causes gradual pricking type of pain in the sides, causing pliha vruddhi, that is sphenomegaly. The next one is gulma. यस्य वायुः प्रकुपितः गुल्मस्थाने अवतिष्ठते शोफं शशूलं जनयन् गुल्मः तस्य उपजायते. When the vitiated vata inhibits in the abdominal region causing swelling and the pain, it is called as gulma. The next one is ruddhi. यस्य वायुः प्रकुपितः शोफ शूल करश्चरन् वंशनाद दूषणौ याति विद रुद्धिः तस्य उपजाते. When the vitiated Vitiated vata moves from the groins to testicles, causes swelling and pain. It causes ruddhi, that is testicular swelling. Next one is Udara. Yasya vatah prakurvitah tvak mamsa antara ashritaha shocham sanjanayet kukshau udaram tasya jayate. When the vegetated dosha, that is vata, located between the skin and muscles, produces swellings in the abdomen, it is known as udar roga, that is disease of abdominal cavity. Anaha, that is distension of abdomen. यस्य वातः प्रकोपितः कुक्षिम् आश्रित्य तिष्ठति न अधो व्रजति न अपि ऊर्ध्वम् आनाः तस्य जायते. When the vitiated vayu strikes, it is causes anaha, that is obstruction in the रोगश्च उत्सेद सामान्यात् अधिमांस अर्बुदादयः विशिष्ट नामरूपभ्यां निर्देश्यः शोथ संग्रहे. Various types of names and features such as adimamsa, that is fleshy growth or extra growth of the muscles, and arbuda are included in the family of shota due to common appearance of swelling. The next one is Rohini. Vata pitta kafaha yasya युगपत् कुपिता जिह्वा मूले अवतिष्ठन्ते विदहन्तः समूर्छिता जनयन्ति भृशं शोतं वेदनाश्च पृथग्विधाः तं शीघ्रकारिणः रोगं रोहिणी इति विन्दते. त्रिरात्रं परं तस्य जन्तोः भवति जीवितं कुशलेन तु अनुक्रान्तं क्षिप्रं सम्पद्यते स्तुकिः. When all the tridoshas gets aggravated simultaneously and inhabit at the base of the tongue, they cause severe burn sensation, acute or intense swelling, and various types of pain. This fatal disease known as Rohini, that is diphtheria, if afflicted with the ailment and left untreated, the patient could die in 3 days. But if treated by an expert physician quickly, one can recover almost immediately. Prognosis of diseases, it is very important concepts. सन्ति एवं विधाः रोगाः साध्यं दारुणं सम्मताः ये हन्युः उपक्रान्ताः मिथ्याचरणे वा पुनः साध्याश्च अपि अपरे सन्ति व्याधयाः मृदुसम्मताः यत्नाय अत्नकृतं येषु कर्मः सिद्ध्यति असंशयम् असाध्यश्च अपरे सन्ति हि व्याधयाः याप्य संगीताः सुसाध्य अपि कृतं येषु कर्मं यात्राकारं भवेत् सन्ति च अपि अपरे योगाः येषु कर्म न स्थिति अपि यत्नकृतं बालैः न तान् विद्वान् उपाचरेत् साध्याश्च अपि असाध्याश्च व्याधयः द्विविधाः स्मृताः मृदु दारुणभेदेन ते भवन्ति चतुर्विधाः. There are certain curable diseases that become fatal if improperly managed or not given adequate treatment. There are other curable diseases that are mild and get alleviated certainly with or without treatment or effort. There are incurable diseases considered palliable in which appropriate treatment enables a patient to move along. And finally, there are other incurable diseases that do not respond to any treatment. At times, ignorant physicians treat this enthusiastically. However, the wise should not treat them. Thus, diseases primarily of two types, curable and incurable, depending upon their severity and responsiveness to the treatment. Into two subcategories within these types. Criteria for classification of disease. त एव अपरिसङ्ख्यया विद्यमाना भवन्ति हि रुजा वर्ण समुत्थान स्थान संस्थान आदिभिः व्यवस्थाकरणं तेषां यथा स्थूलेषु सङ्ग्रहः तथा प्रकृति सामान्यं विकारेषु उपदिश्यते. There are several diseases classified on the basis of pain, appearance, etiology, site, symptoms, and name. Their systematic classification has been attempted in the form of some gross disease families and classes. However, in other cases, general principle may be followed. The next one is very important concept, identification of new disease. विकाराणाम् अकुशलो न जहीयात् कदाचनः न हि सर्वविकाराणां नामतो अस्ति ध्रुवा स्थितिः. स एव कुपितदोषाः समुत्थानविशेषतः स्थान अन्तर्गतश्च वा जनयन्ति आमयान् बहून् तस्मात् विकारप्रकृति विकार अधिष्ठान अंतराणि च समुत्थान विशेषांश्च बुद्ध्वा कर्म समाचरेत यो हि तृतीयं ज्ञात्वा कर्मणि आरभते भिषक् ज्ञानपूर्वं यथा न्यायं स कर्मसु न मुह्यति. First line, Vikaranam Akashalo no jiya kadachana. All the diseases are not named, or no need to know the diseases of all the names. Based on the Kupita dosha, Samuttana Vishesha, Sthana, etc., the diseases are produced. Hence, three factors which are very important to diagnose a disease, which are Tasmat, Vikara Prakriti, Vikara Adhisthana, and Samuttana Vishesha. These are the three factors responsible for naming a disease or identifying or diagnosing a disease. That's why these three things are called as Trivida Bodhavya Vyadis. First one is Vikara Prakriti, that means Vikara means disease, Prakriti means that is constants, that is how this disease is produced. The second one is Adhisthana, where exactly this disease is produced or what causing the problem. Last one is Samuttana Vishesha, that is Samuttana means Hetu. First factor, that is Vikara Prakriti, it helps to diagnose a disease or know about the disease. Then Adhisthana means where we have to concentrate, at which part of the body we have to concentrate. This thing will be helped in the by the Adhisthana. And last one is Samuttana Vishesha. By this, we know the Nidanas of the disease. Hence, we can do the Nidana Parivarjana. These are the Trivida Bodhya Sangraha. By the proper knowledge of these factors, one can diagnose a disease and he can perform or he can treat a disease in a better way. That is karmasu na nuyati. That means if he knows properly, it will not cause any confusion. Normal functions of Vat dosha. उत्साह उच्छ्वास निश्वास चेष्टा धातुगति समाह समः मोक्षः गतिमतां वायोः कर्म कर्म अविकारजम्. That is प्राकृत वायु कर्म उत्साह उच्छ्वास निश्वास चेष्टा gati of dhatus and moksha, that is elimination of malas. They are the functions of prakruta vata. The next prakruta pitta lakshanas. दर्शनम पक्ति उष्मा च शुत तृष्ण देहमार्दवम प्रभा प्रसाद मेद च पित्त कर्म अविकारजम. The last one prakruta kapha dosha karma स्नेह बंध स्थिरत्व गौरव रुषता बलम क्षमा धृति अलोभश्च कफ कर्म अविकारज. Diagnosis of abnormal state of doshas. वाते पित्ते कफ च एव क्षीणे लक्षणम उच्यते. कर्मणः प्राकृतात् हानि वृद्धिः वा अपि विरोधेन. Any diseases in Vata, Pitta, Kapha in thus indicated by a decrease in their natural function or increase in functions of opposite dosha, that is indicated by properties associated with any type of doshas. For example, reduced unctuousness indicates decrease of Kapha, etc. By this, we can diagnose abnormal state of doshas. This is the last shloka. Dosha prakriti visheshyam niyatam ruddhi lakshanam doshanam prakriti hani ruddhischa eva parikshate. Conversely, any aggravation in dosha is indicated by an increase in their normal function. Thus, normalcy, increase or decrease of dosha are examined. By this, we complete the chapter.
Hello.
Hello.
Yes, sir.
Okay, by this we finished the chapter.
Thank you so much, sir. We are the team Panchajanya. We are very grateful to have you here. Whatever doubts the students have, I think they can approach you and ask for the doubts.
Sure, definitely. No issues.
Thank you
Thank you.
once again, sir.
Thank you. Thank you. Thank you.